During pregnancy and the postpartum period, many people feel that they have to make a choice between addressing their mental health concerns and the health and well-being of their children. I think what's great about Prosper is it allows us to get the best information for our patients so that we can provide them with that so that they can make the most informed decisions and really kind of correct that misinformation.
With 1 in 5 women experiencing a mental health or substance use disorder during the perinatal period, the pressure on providers to diagnose, screen, and support care has never been greater. I'd like to introduce you to Colorado Prosper, a free resource supporting providers across Colorado. Prosper stands for Perinatal Resource Supporting Obstetric Screening, Psychiatric Education, and Referral. We are available to take almost real-time consultation calls from OBGYNs, midwives, family practice and other primary care providers, as well as nurses, doulas, lactation consultants, anyone who's taking care of mothers in the perinatal period. We have psychiatric consultation or peer-to-peer consultation where you can call us about a complex case. We also have a full-time resource and referral specialist who can provide tailored resources for medication needs and therapy, support groups, other things that new parents might need.
What I love about Colorado Prosper is it provides a very practical and easy to utilize tool to actually incorporate the most current guidelines into your everyday practice.
In the postpartum period after I had both my second baby when I lost and my third, I was seeing nurse practitioners and OBs in the clinic, and there wasn't really a focus on what I needed in that moment. I struggled throughout my third pregnancy with a tremendous amount of anxiety, but I know I didn't need to struggle. If my providers would have known that there are experts here, you can guide this mom in the right way, it would have been very uplifting and reassuring to know that there are experts in this area and I don't need to suffer alone.
If you get a negative screen and you feel like the mom in front of you really does look depressed or anxious, how do you have a conversation with her where she feels comfortable to talk to you about these issues?
We know you want to do more for your patients, especially when it comes to their mental health and substance use concerns, but it's not always clear what to do next. The guidelines are expanding, but support hasn't always followed.
I currently live in Salida, Colorado, and I work at Heart of the Rockies Regional Medical Center doing family medicine with OB. In a rural area, it is unique because there's a lot less access to specialties, resources, and patients will also travel a long ways to get to us, and we're already rural to begin with. We do not have many perinatal health specialists in the area, and as family medicine, you're doing a lot of everything. Recently, I called Prosper because one of my postpartum patients was having some pretty significant postpartum depression. I had a general idea of what to do, but I also know that there's a lot of new medications for postpartum depression and was wondering if the patient was a candidate or if there was some other sort of medication that could help this patient. I called Prosper and I was able to talk through the case with the psychiatrist who was on call. She was fantastic in telling me, I think this new medicine would be very helpful. This is the dose, this is how you prescribe it. You might get insurance kickback, this is what I would do. And that was so helpful for me. It was also helpful to talk about these are common side effects, this is the duration of the medication, this is what I would counsel the patient about. After that, you get a summary from Prosper of the patient case. And then a very useful thing that I got from this most recent calling of Prosper was patient resources. And so Prosper has virtual support systems for patients, whether that be support groups or intensive outpatient counseling. And I find a lot of my patients are a lot more interested in that sometimes than medications.
I want providers to know that they're not alone in making mental health decisions for their patients, particularly in our population, which is a very underserved population, because during the pregnancy and the postpartum period, many people feel that they have to make a choice between addressing their mental health concerns and the health and well-being of their children. And I think what Prosper does is it provides you the information so that you can make the best informed decision for you and your situation so that you can maximize both of those things. Prosper helps us get resources to providers so that they can best counsel patients so that they can make those decisions and hopefully have the best outcomes.
When you contact Colorado Prosper, we really join the team that works directly with you to wrap around the patient and really to provide all of the support that you might need in your care of the patient and to consider what resources might be needed for her to have the holistic care that both of you are looking for.
We know not everyone wanted to be a psychiatrist, so Colorado Prosper is here to support you in meeting the patient where they're at and providing that evidence-based care and trauma-informed care, and it can make a big difference to get them access to care sooner. So give us a call at Colorado Prosper.